How to read a normal chest X-ray. This is Dr. Tarun Kothari and I am making this video because few of my students have asked me to make a video on how to read a normal chest X-ray. Before you read the anatomical and the pathological details of the X-ray, you must see the few very important points. So first of all, you must check the name of the patient because sometimes the X-ray might be of the patient A and you might be reporting the some other X-ray of the B patient. Always check for the age of the patient, check the sex of the patient, and always see the date of the X-ray taken is very important. This X-ray might be the recent one or maybe sometime the old one. See which part of the X-ray is this and check the view. It's a PA view, it's AP view, or it's a lateral view. Take the history of the patient, that is very important, either from prescription or from the patient, and always look for the any previous X-ray. If it is available, it is very useful to make a diagnosis. Next one is the next few important points are slide, like the side rotation, inspiration, projection, and the exposure. These few points are important before you make a diagnosis. Now coming to the side of the X-ray. So concerning the patient is just in front of you. Assuming the patient is in front of you, facing you, so the your left is patient right and your right is patient left. So the your left is right of the X-ray and your right is the left of the X-ray. Plus, you must see few important points like the apex of the heart is on the left side unless or until there is a dextrocardia. Or usually you will see this gastric bubble on the left side and diaphragm is usually on the higher than the left side. After seeing the side of the patient, you must see for the other features like the rotation. The rotation is it is normal, that it is center is normal, it is centering is proper or not. So to see the rotation, the important point is to see the trachea and then to see these spines. You can see this is the spinous process. This spinous process is important, and look at the medial end of the clavicle. This is the middle end of the clavicle, this is the middle end of the clavicle, and the distance from the medial end of the clavicle to the spinous process should be equal on the both sides. In this X-ray, you can see there is a slight rotation because the distance on both sides is not equal. Coming to next picture, you will see here, you can check here, you can see this is the medial border of the clavicle, this is the middle border of the clavicle, and these are the spinous process. So here you can see the distance is proper, so this X-ray is centering is good, there is no malrotation. Some, if you want to count the ribs, this is the posterior end of the rib and this is the anterior end of the rib. The posterior end is usually seen to be attached on the lateral process of the vertebra. The next one is, you will see here, the this is again, you can see everything is good here, but next is the film is inspiration or film is in expiration. This is the important point. A film taken in the inspiration, you will see at least 8 to 10 uh, posterior ribs and about 5 to 6 anterior ribs above the diaphragm. So here you can check is, this is your first rib, so this is the posterior part of first, this is your second rib, so this is the posterior part of second, this is your third rib, so this is the posterior part of third. So third, this is fourth, this is fifth, this is sixth, this is seventh, this is eighth, this is ninth, and this is 10th. So you can see the 10th number of ribs or the 10 ribs above the diaphragm. Like you can see This is the first rib, this is the second, this is the third, so this is the fourth rib, this is the fifth rib, this is the sixth rib, and this is the seventh rib. The seventh rib you can see here above the diaphragm and approximately uh, mid side of the at the mid part of the right lung. So here you can see it is the patient has taken the proper inspiration. When you take the inspiration, the lung will inflate, and if the patient is not doing proper inspiration, the lung will not inflate properly. In that case, you can see this is the counting of the ribs again. Here you can check the two films, compare the inspiration and the expiration series. You can see here, in the case of the expiration, the lung is not properly inflated. So the visibility of the ribs, the counting of the ribs, the posterior end will be less than 8 to 10, and the anterior end will be less than 5 to 6. After the inspiration expiration, the important point, the projection. The film taken is PA or the AP. It is the usually we take the PA film. AP sometimes we take particularly for the bone fractures, for the fractures of ribs and etc. So you can see in the PA film the heart size is looks normal, while in the AP film the heart size will be seen as enlarged. Although it is not enlarged, but it will see that the heart size is more. Plus, you can see in the PA film, the scapula are out of the lung field, while in this case, you can see the scapula are partially in the area of the lung field. So these 2 points are very, very important for the PA and AP. I will make a separate video on this topic also. Here you can see the next important point is the exposure. It might be hypoexposure, it might be hyperexposure, or the underexposure, or the overexposure. In this, the A will show the overexposure. In the case of the overexposure, this lucency will increase, and you can see all the structure behind the heart. While in the case of this B, you can see this particularly the accentuation of the pulmonary vessels. So A is hyper and B is hypo. So this is B is less exposed and A is high exposed. Then you must see the A, B, C, D, E, F. A is for the airway, B is for the breathing or the lungs, C is for the cardiac or the heart, and D for diaphragm, E for everything other, and F for any foreign particle, foreign body, either medical or pathological. So here you can see this is trachea. Always see the trachea is the trachea in midline or not. Trachea might be deviated. If the trachea is deviated, so it could be have two types of the pathology. Either the trachea is pushed or the trachea is pulled. If there is a pneumothorax, the trachea will be pushed, and if there is a fibrosis or if there is a uh, uh, lobar collapse, it will be pushed. This is the trachea. See for the any other pathology like the tracheal mass or some obstructive pathology in the trachea. Then you can see the trachea is divided into two parts. That is the right main bronchus and the left main bronchus. The right main bronchus further divided into two parts: the upper lobe bronchus and the bronchus intermedius. This is very important. Bronchus intermedius. While on the left side you will see the upper lobe bronchus and the lower lobe bronchus, and this bronchus intermedius on the right side will further divide into two parts: the middle lobe bronchus and the lower lobe bronchus. This division of the trachea is this point is called as a carina. This carinal angle should be less than 90 degree. If this angle is more than 90 degree, it is usually suggestive of some lymph node enlargement. Next, after this, after the airways, you must see the lung tissue or the breathing. So you can see there are hyla, right hilum, left hilum. Here is the aortic notch. This hyla, what is the hyla? Hyla or the hilum. Hilum is basically the structures that enter into the lung proper. So it includes the vessels, nerves. So you can see the hyla is usually concave. Hilum is usually concave like this, and this concavity is laterally. So hyla are concave laterally, and you can see the right hemidiaphragm is above the level of the left hemidiaphragm, but for this hilum is it is opposite. The right hilum is below the left hilum. Then you can see the various other things like after the hilum, the heart. Heart is important. Uh, so you can see here, this is basically left ventricle, and this is your left atrium, and this is your right ventricle, and this is your right atrium. And right at the right atrium receives the blood from superior vena cava, from chest and the head, and the inferior vena cava from the lower part of the body. Then this heavy diaphragm makes two angles. So these are the costophrenic angles, and you can have the cardiophonic angles. So the costophrenic angles, where the chest wall meets with the diaphragm, is the costophrenic angle, and where the heart meets with the chest wall is the uh, cardiophonic angle. Next one you can see here. So again, this is the trachea, then this is the left ventricle, this is the part of the esophagus here, this is the gastric shadow, gastric bubble seen here. Then this is the right lung divided into two parts. This is the left lung divided into the two parts. Right lung has basically three lobes: the upper lobe, middle lobe, and the lower lobe. And the left lung is usually has two lobes, upper and the lower. Then you can divide. Then how to measure the cardiomegaly? So to measure a cardiomegaly means the heart size is more. So heart size is increased. So first of all, take the length, that is the cardiothoracic ratio. So take the length of the thorax from inside to the inside. Suppose this is 20. So length is the 20. Then take the width of the heart, width of the thorax and the width of the heart. So width of the heart, usually what we do, we take a line from A to B and measure as a width of the heart. But the exact measurement, for the exact measurement, you must take, you must draw a lines in the central part, and then you divide the width in two part, A and B. So A is there is a transverse line from the maximum bulge of heart border to the right side of the midline. Likely this B is just opposite, and then calculate A plus B. This will be the actual width of the heart. So divide this with the uh, width of thorax, and you will get cardiothoracic ratio. If this cardiothoracic ratio is less than 0.5 or less than 50%, it is a normal. If it is more than 0.5 or more than 50%, it is abnormal. Although in the children, up to 60% is taken as normal. So after the heart, you must see the other features like diaphragm. So diaphragm here is taken. So right diaphragm is usually on upper side, and the left diaphragm is usually the lower side. Then you must see the everything others like the mediastinum. So what is the mediastinum? The mediastinum is the anything in between two lungs, like the esophagus, trachea, heart, vessels. They are part of the mediastinum. Then you must see the soft tissue. For any soft tissue mass, benign or cancerous. Must see for pleural thickening or the pleural mass. Angles must be seen to see for pleural effusion. Then you see the gastric fundus. It is placed at normal side or it is placed at abnormal side. In the case of the herniation, you will find the bowel lobes in the thorax. Then see for any bony fracture. It is very important to see the bones Lastly, you must see the other parts like the foreign materials, like the internal foreign bodies causing obstruction of the trachea or the other internal foreign bodies, or might be some bullet guns injury. Then see the other medical parts like the pacemakers, ECG leads, esophageal tubes, etc. I think this is all about a normal chest X-ray. I will make few more videos on abnormal chest X-ray step by step. Thank you for watching it. Thanks.